Aesthetic Video Source presents Microdermabrasion, today's answer for tomorrow's more youthful-looking skin through cosmetic technology. Designed as a mechanical stimulation of the skin, microdermabrasion uses a new technical application of dermabrading or peeling the skin. By what is called kinetic disruption of the stratum corneum, microdermabrasion acts to stimulate the production of new, living cells at the basal level. By spewing micronized aluminum oxide crystals on the skin, microdermabrasion skin resurfacing is the latest rage in cosmetic dermatology. Although widely used in Europe and Asia for nearly a decade, microdermabrasion's FDA approval for use in the United States came late in 1996. Since then, microdermabrasion has revolutionized the skincare industry by providing the long-awaited, non-invasive service for the reduction of fine lines, wrinkles, blemishes, and scars. The following program is designed to help skincare professionals learn more about microdermabrasion, the process, the tools, its application, and ways to successfully market this service.
The one thing that we all have in common is the aging process and wrinkles. And because we are in a never-ending society that is looking for the ultimate treatment to reduce wrinkles, one thing that we can say about microdermabrasion is that it is very effective in reducing the appearance of some of the deep wrinkles, the medium wrinkles, and the very fine lines. This your client is going to find to be a very important part of their skincare treatment program in looking much younger and healthier as they age. The skin is the body's largest organ, and probably it is our most abused organ. And unfortunately, through environmental assault, when we are out in the sun unprotected, or smoking, or drinking coffee, or taking drugs, what we do is we potentiate the aging process. Now, there are two important parts of the skin that we need to pay attention to when we are utilizing microdermabrasion, and that is the epidermis and the dermis. The epidermis is comprised of 5 main layers, beginning from the basal layer to the stratum corneum. The stratum corneum constitutes 75% of the volume of our epidermis. And this is very important because the handpiece which you apply to the epidermis will come directly in contact with our stratum corneum. And during microdermabrasion treatments, you will find that the lymph is stimulated as well as the blood supply, which is very important to note while you're doing these treatments.
The two functions of the microdermabrasion machine are crystal flow and vacuum pressure. The crystals are made of aluminum oxide, which is also known as corundum. The aluminum oxide crystals are irregularly shaped, which makes them very effective for exfoliation. The first system utilizes corundum crystals. The crystals are very hard, a 9 on the Mohs scale of hardness, next to a diamond, which is a 10. Upon contact, a small amount of crystals is projected onto the skin, providing a mild abrasion. The corundum crystals interface with the stratum corneum to exfoliate the uppermost layers of the skin. In a sense, the corundum crystals act like microscopic scalpels by physically piercing the skin and removing a piece of the stratum corneum. The second system is a vacuum apparatus, an integral component of most machines, which provides a suction action to stimulate the dermis. This aids in the realignment of collagen and elastin. The user controls the flow rate of the crystals as well as the vacuum pressure.
The two components in the dermis that are stimulated are the lymph and the blood. This is important because the lymph in itself helps to augment the immune system, and the blood brings the oxygen and the nutrients to the skin in helping to feed the skin. These are essential elements while you are performing microdermabrasion that you will be utilizing during these treatments. Physiologically speaking, we can say that microdermabrasion is highly responsible for helping our collagen to realign itself within the dermis. This is important because if you are working with patients who are addressing the needs from environmental stress and have aging skin, we want to encourage more collagen deposition in the skin itself to bring about a more supple and healthier looking skin. When we view the dermis, it's important that we look inside the dermis and the activity that is stimulated by microdermabrasion. One important cellular component is the fibroblast, which is responsible for both elastin and collagen production. This is important to note, especially when you are working with patients who have had overexposure to the sun and have a loss of elasticity and collagen brought upon by environmental stress. Technically, moles and freckles are hyperpigmentation because they do project color on the skin. And many times patients will ask me, well, can I get rid of these? Well, that's like a zebra getting rid of their stripes. That has been genetically programmed, and at the best, we can probably lighten it up, but it's not going to completely match the same color as the rest of our skin. So realistically, it's best to advise your patient that that is going to be around with them for a long time. Let's take a look at some examples here of some hyperpigmentation. We take a look at this sun-damaged skin, which has been obviously exacerbated through ultraviolet radiation and superimposed on the innate aging process. Now we look at the freckles, and we've already addressed the freckle before, and keep in mind it's like getting rid of a stripe of a zebra, so the best we can do is maybe lighten it. Post-inflammatory hyperpigmentation in this particular picture, this is one of the biggest problems that we find associated with peels and with lasers. You will find that working with microdermabrasion that this will help to resolve this condition. Seborrheic keratosis is another problem that is brought on by the sun. In fact, too much sun damage has been superimposed on this skin. The pregnancy mask again, and we look at this patient that has this mark of pregnancy, again has been out in the sun and which has initiated that melanocyte stimulating hormone and has created this horrible discoloration on the skin. All of these conditions of which we've just spoken about can be quickly and effectively resolved through microdermabrasion treatments in conjunction with tyrosinase inhibitors. And we want to emphasize that microdermabrasion alone cannot do it. You need to use a tyrosinase inhibitor.
Sun-damaged skin requires special attention. In the initial treatments, the vacuum should be turned down low to avoid harming the skin's fragile epidermal-dermal junction. Treatment should be definitely done in increments in a non-aggressive manner. For the treatment of acne, microdermabrasion has been found to be very effective. By providing the skin with increased oxygen, microdermabrasion helps the acne to actually heal much faster.
Art is with us today because he is concerned about the continuing acne problem that has plagued him for many years, as well as the acne scars that are definite markers of his post-traumatic acne syndrome. We're going to be utilizing microdermabrasion treatments today to help resolve some of the conditions of his skin and make it look smoother, and also to return the skin to a more normal clarity. We have diagnosed him as a Fitzpatrick 4 skin type because if Art goes out into the sun unprotected, he will escalate his hyperpigmentation. Before the microdermabrasion treatment, we need to cleanse and prepare Art's skin thoroughly. Utilizing an appropriate cleanser is very imperative to this treatment because it needs to remove the lipid barrier. Removing the lipid barrier will give you a more even peel. I'm going to start off with using a very mild glycolic cleanser because this will help to go into the follicles in itself. It's extremely skin friendly and it will not suds up. Make sure you thoroughly put it on your hands using gloves. Now if you take a look at Art, we do have the obstacle of a beard here, so we're only going to be treating the exposed areas. I'm going to use very light effleurage movements, because one of the things that I don't want to do is I don't want to stimulate too much of the blood flow, which will create a false reading of erythema. When you're doing microdermabrasion, you need to use erythema as your end point. So if I stimulate the skin too much, I might not have that appropriate reading, which I need. I find it very important that you educate your client on acne before you proceed with microdermabrasion. Your client will ask you, what is acne? Well, it's very simple. Acne is a disease of the follicle. On our face, we have 3 different types of follicles. However, it is the sebaceous follicle that is targeted for this potentially disfiguring disease. There are 4 types of acne that you will categorize your client into: grade 1, grade 2, grade 3, and grade 4. Grade 1 is the least severe, with grade 4 being the most. Grade 1 is generally open and closed comedones that are non-inflammatory. And when we mean that, they are not red or oozing with different infections. You will find more of the open and closed comedones, being grade 1, which will have open comedones, which are the blackheads that you find on the nose and on various parts of the facial skin. Grade 2 is probably the most stubborn and the most deceptive of all acnes because it resembles almost a little road, a rocky road on the skin, if you can imagine. It is all closed comedones, and what has happened is all the sebum has become entrapped into these follicles and literally has become petrified, and therefore it requires more aggressive treatments for it to be able to get under control. The next 2 types of acne are grade 3 and grade 4. Grade 3 is probably the most typical type of acne that you will be treating. Grade 4 is the most severe type of acne, which generally they are put on more aggressive types of treatment to come under control. Grade 3 you will find papules, pustules, and nodules on the skin, as well as open and closed comedones. You'll find very inflamed areas, and you'll find it dispersed throughout the entire face. Now, acne moves like a wave across the face, so typically when an adolescent begins a grade 3 acne, you'll find that it starts in one area and begins to progressively move to another. Grade 4 is all of the above. That's the nodules, that's the papules, that's the pustules, and the open and closed comedones, along with the cystic type of lesions. This is potentially very disfiguring and does require to get it under control with more systematic treatments and utilizing other modalities such as peels to be able to get this particular type of acne ready for microdermabrasion. Now I'll remove the cleanser, and I'm going to use what is called the barber towel method. I find this to be the most effective approach when removing any cleansers or masks or any other type of skincare product when you are using a cleansing process. You place it directly under the nose, take your finger around the left side of the nasolabial fold to the right side of the nasolabial fold, and then just press. This is very soothing, very relaxing to the client. The nice thing about using this particular method is that it gives you mitts and allows you to thoroughly remove this cleanser. Now I will follow through, and because Art has a beard, I've elected to use the gauze. The gauze will not catch on the beard stub as much as the cotton will. Cotton will leave little trails, so it's important that you select the appropriate removal for your cleanser. And you can start at the forehead. The nice thing about gauze is it will pick up any epithelium left on the surface as well as residue cleanser. Removal of the cleanser is essential. You want to ensure that all of the residue has been taken off of the skin surface. We'll follow through with using an astringent, and because Art has an acne condition, we're going to use the appropriate astringent for his skin type. I have again chosen to use the gauze because of the condition of having the whiskers throughout this area so it won't snag these cotton fragments. I'm going to begin by the forehead. I'm going to work in the solution into the skin. It's important you make contact and thoroughly remove all residue. Avoid contact with the eyes. And generally how you can do that and be more effective is if you take your gauze or cotton pad and when you're going to go under the eye, you go up and then away from, as opposed to running into the eye itself. That's very important. Everything that you do within your clinical environment should be focused on detail, not just application of product, but the detail of how you are performing your treatment. Now, we must wait till this solution thoroughly dries before we begin our microdermabrasion treatment. One of the most effective ways to treat acne before you begin microdermabrasion is using benzoyl peroxide therapy. Benzoyl peroxide therapy, what it does is it liberates a reactive form of oxygen in the follicle. And what this oxygen does is it kills the bacteria. The bacteria cannot thrive within that follicular environment with oxygen. In addition to which, benzoyl peroxide also creates a desquamation on the sides of that follicle to help unplug the dead skin cells, the sebum, as well as reduce the bacteria count. A large part of the success that getting acne under control is going to be borne out by your client. Ensuring that your client is on the proper nutritional supplements, void of any iodides which actually exacerbate the acne condition, in addition to eating the proper foods, also need to be on the proper products from a day-to-day basis. Acne needs to be treated daily, at least twice a day, and sometimes 3 and 4 times a day. One of the most important elements, and probably the least expensive, that your patient will use is ice. They need to ice their skin daily, which will help to reduce the inflammatory response. And what that does is that also will reduce the advent of them to become scarred because of the more aggressive acne.
I usually wear a mask, and I always suggest everybody wear a mask, but since I'm talking, I can't wear a mask. But always wear a mask and glove for safety. And you start the treatment, turning on the machine, turning the vacuum down. Always test the vacuum on your hand or your arm to make sure it's not too strong. And I'm going to work across the forehead, starting at the top of the forehead, working across. We want to have a completely even exfoliation here. If the skin stretches at all, make sure you hold it taut between 2 fingers because you don't want the handpiece pulling the skin up into it, stretching the skin. Always watching the erythema, making sure you're not overdoing it. And if you're working on problem areas, you can scrub it back and forth. And you can even go back over it in a grid-like fashion. You do not want to break skin or bring up blood. If you find a scar area, you can work that a little bit more than the rest. Okay, now you want to turn your head this way, Art. Thank you. Work your way down the face, making sure that you cover every area so you have a completely even exfoliation. You can actually see what the areas you've worked. The skin appears lighter. Make sure your client keeps their mouth and their eyes shut. Work exactly the same way down the other side of the face. Again, working every part of his nose. And then to go down the ridge. can see it's nice and red. Okay, now to work his eyes, we're going to turn the vacuum down. And I'm going to turn the vacuum down low, and you can actually hear the compressor when you have the vacuum turned all the way down. And you would turn it down like this if you're doing around the eye areas, or really sometimes people are extremely sensitive to microdermabrasion and you do the whole treatment with it very low. And then if you want to go in and do some serious microdermabrating, you turn it up. And you can monitor your vacuum by watching the vacuum gauge and making contact. Keep your eyes closed, holding the skin taut. You feather to the outer edge of his eyes. And then on this side, again holding the skin and feathering out. And the eye area is extremely sensitive, so you want to make sure your vacuum is down. Once you're done with the treatment, you want to brush the loose crystals. Avoiding the eye area, making sure they keep their mouth and their eyes closed. Working away from their eyes. And then you can pick up the residue, any residue that's left. And his face is a nice even pink. Next we'll apply the living cell clarifier, which is a tyrosinase inhibitor for pigmentary problems. Okay. And then we'll end with sunscreen, and it's really important to tell your client that they have to wear sunscreen for at least 7 days.
Many patients that I've treated in the past, because of their nutritional deficiencies, has actually exacerbated their condition of acne. When we take an overview of what they are eating, what we will look at is the iodides in the contents of their food. There are specific foods that literally have high contents of iodides. These are the things that you want to eliminate, in addition to taking the proper vitamins. Acne vitamins have the appropriate amounts conducive to an acne condition, such as zinc, which will reduce the inflammatory response, and vitamin C, which will help to initiate the healing process of this specific skin condition. There's also other important elements that will be introduced into the system that will help to augment the healing process of this particular disease. Many of the acne patients that I have treated have been on antibiotics, and those antibiotics have been very ineffective. And what I've asked my client, I said, the reason you have acne is not because of the lack of antibiotics in your system, it's because you've genetically inherited this disease, and because of other outside elements, you have exacerbated the condition. I have many patients that I have treated in the past, and probably the biggest problem you'll find, and whether or not they've had acne or whether or not they have pigmentary disorders, we all eventually age. And we ask ourselves, how does skin age? Well, there's two different ways that our skin ages, and that's through the extrinsic process and the intrinsic process. Now, what we find is that many patients that I've treated, I've had 20-year-olds that look like 50-year-olds. I've had 50-year-olds that look like 20-year-olds. And what is the common denominator here? It's the sun. It's drugs, it's smoking. It's all those environmental factors that step up this aging process and break down the important elements that are inside our skin that help keep us young and youthful looking.
Microdermabrasion is more than just a simple treatment. It is an organized protocol of skin assessment, skin diagnosis, and skin care. With microdermabrasion, there is no downtime or side effects, and the client can go right back to work. Appropriate protection of a physical sunblock and medical makeup with titanium dioxide is strongly advised following microdermabrasion treatments.
What makes microdermabrasion so effective when we're working with the skin and the regeneration of the cells is through the kinetic disruption. What that sends are messages down to the basal layer and the turnover of the cellular reproduction. Many times through the environmental stress or through the aging process, we find that those cells have become a little slower in their activity. So with kinetic disruption, it helps to wake up those cells and allow those cells to become more productive in how they are able to reach the surface of the epidermis to become healthier, more viable cells. Many times our clients will ask us with respect to their skin, how soon will they see the changes with microdermabrasion? Well, we all know that cellular activity is genetically programmed. Typically, it takes up to 28 days for a cell to be born from the basal layer and reach the epidermis. However, because of this genetic programming, it can take up to 31 days. In order for you to be safe and to give your patient the appropriate direction and how well the skin will begin to look after they've had these treatments, it's best to take note that they wait a full 30 days for them to really make a true evaluation. One of the biggest problems associated with environmental stress that your clients will talk about is hyperpigmentation. This is directly related to inflammation, which is a universal trigger. The downside of using acids with your clients is leaving them on too long and becoming too aggressive, therefore causing a problem called post-inflammatory pigmentation. The beauty about microdermabrasion is that you do not have to worry about initiating too much of a good thing. In other words, by applying microdermabrasion, you're not going to be initiating the melanocyte to become provoked, therefore creating that post-inflammatory pigmentary disorder. One of the largest populations of pigmentary disorders that we will be treating with microdermabrasion will be women who are currently undergoing menopause, who never before experienced pigmentary disorders, but because of the hormonal fluctuations in their body are now currently experiencing these discolorations on their skin. There are also other contributing factors that we need to take note of. For instance, birth control pills. Many young girls go on these hormonal replacement therapies using these pills, and they go out in the sun. Thus, what happens is that their skin turns a different color. Also, pregnancy is another avenue that we have to pay attention to, as well as nutritional factors. Intrinsically, we have to take note that antibiotics can also cause hyperpigmentation, as well as UV radiation, which is our main cause because it creates an inflammatory response. Chemical peels, which we have also covered, we need to really take note on because when we are overaggressive, pigmentary disorders are the end result and the contraindications of this disorder. And also, one disorder that we have to take a look at that many women and many men don't take note of is after laser. Laser surgery has a lot of pigmentary disorders that occur based on that it is a side effect. 40% of the laser patients that undergo this procedure will experience hyperpigmentation.
Microdermabrasion is an excellent tool to prepare the patient for carbon dioxide or erbium laser procedures. It is recommended that a series of microdermabrasion and cosmeceutical treatments be performed on the patient 4 to 6 weeks prior to laser surgery. The benefit to conditioning the skin prior to laser has been reported to decrease the amount of energy and quantity of passes the surgeon has to use on the skin and may result in a faster recovery period due to less thermal injury.
There are two important elements that the physician and esthetician need to pay attention to when doing microdermabrasion, and that is the handheld appliance. This handheld appliance can be very important because it helps to control the desquamation that's occurring by applying the kinetic disruption using this mild sanding on the top of the skin, and also the suction, which creates the lymphatic interaction within the dermis. As this handheld appliance goes across the face, it does stimulate the lymph flow. This is important because lymph is part of our vascular system. Our lymphatics are responsible for augmenting our immune system, and our capillaries are responsible for bringing the oxygen and the nutrients to the skin. This is vital because what we are generally initiating is that we are creating a healthier skin by stimulating these very important components that lie within the dermis.
Okay, Carlos, how does that feel?
Feels good.
Feels good?
It kind of tickles a little bit.
Tickles a little bit, and Carlos comes up red really fast, so we need to watch him closely and actually turn down the vacuum a little bit. And his skin is a little dry and flaky. Okay. He's losing his bonnet. Okay, then we're going to go back over it, working it vertically. And like I said before, you can work a grid on areas that you're seriously working. Watching to make sure you're not breaking skin, maintaining a consistent redness. You can see that it's very even. Okay, then we'll go down. And you can also go up into the hairline. You want to turn your face this way? There you go. Into his beard. And your clients who have acne, you might warn them that they could experience a breakout after this treatment. Not always, but sometimes they will. Okay. Get his nose. Cheek area. And I always do the eyes last. Chin. Some of these boys will have goatees. Don't let that scare you. Okay, you can see he's nice and red. Okay, turn your face this way, Carlos. Working down the other side into his hairline. How you doing?
Good.
And then we're going to work this area. Bridge of his nose. Turning the vacuum down. We'll go around his eyes. Remind them to keep their eyes closed. Holding the eyes taut and feather out and up. Okay, now we want to do Carlos' neck. So we'll have Carlos put your chin. Now, take your hands and you're going to pull your neck down because the neck gets pulled up into the handpiece and it's a pinch. And then with my other hand, I will pull the top of it and we'll just go up and down his neck. And he has some ingrown hairs. I'm just going to scrub over those. See the redness on his neck in here? And his face seems to calm down really fast. Okay. Okay, we've just applied living cell clarifier to Carlos to reduce his pigmentation problem and redness. But Carlos' concern when he came today is he didn't want to go back to school red. So we are going to put a cold mask on Carlos. Okay. We will leave this mask on for approximately 10 minutes. Next, we will apply a full spectrum sunscreen.
With respect to the types of acne scars, and we typically know there are two types, one being the ice pick type. Unfortunately, microdermabrasion is not able to eradicate this type of scar as it goes so deep into the dermis. The fortunate thing and the upside of microdermabrasion is that we can treat the other types of acne scars, whether they are senile scars or just newly formed scars, to help reduce the appearance on the skin surface, therefore giving the texture and the overall clarity back to the skin. I believe it's important that when we are treating an acne client with respect to scars, that we identify the type of scar that this client has and let them know what we are able to treat and what we are not able to treat effectively using microdermabrasion. Typically, you're going to find most of your clients will have either an older scar or just a newly formed scar that you'll be able to help to resolve and therefore bring about more clarity and better texture to the skin through microdermabrasion treatments. On those ice pick type scars, even dermabrasion have difficulty resolving and eradicating those types of scars completely. There still is mottled skin and the skin never returns to a normal status as which it had before there was acne. So realistically, it's important that when you counsel your client to let them know what they can expect out of microdermabrasion treatments with respect to acne and the conditions of their scars.
Microdermabrasion is an excellent body treatment as well. The skin on the back is much tougher than the skin on the face, so you can work it a little more aggressively. I won't start with high vacuum. Start medium high. How's that feel, Carlos?
Feels fine.
Feels fine. Okay. Now, if you could see Carlos, he has a few scars on his shoulders that we could work pretty aggressively on without worrying about bringing up blood. They're actually kind of fun to work on backs because you get the wide open spaces. Scar and work on that a little more aggressively. You can see where I've worked. Back of his neck, we do the same as we did the front. And you can see it's really red. Working down. Okay. And then we're working on scars, so we'll do a grid again. Watching it to make sure you don't go into the dermis. See the redness where we worked? Okay, and then to finish this back treatment, we'd work all his total back down to his waistline, finishing up on each side, and then we'd do a dust off the aluminum oxide crystals, do a cleanse, living cell clarifier, and sunscreen. Always sunscreen any area that you've worked.
Another important lesion on the skin are stretch marks. Every woman who has one wants to get rid of them. However, when asked, does microdermabrasion help with stretch marks? All we can say, it's very controversial at this time. And we, as a responsible educational company, cannot provide you with all of the documentation to validate the claims that say microdermabrasion totally eradicates stretch marks. In our never-ending pursuit for more youthful-looking skin, one of the modalities of treatment in recent years has been laser skin resurfacing, using either the CO2 laser or the Erbium laser. The unfortunate downside that has occurred has been the line of demarcations that have been left at the jaw line. Microdermabrasion is extremely effective in helping to smooth out those specific lines of demarcation.
Microdermabrasion is very effective in treating whiteheads or closed comedones, blackheads, open comedones, dormant acne scars, linear scars, blemishes, fine lines, facial wrinkles, superficial pigmentation, transient pigmentary disorders, and demarcation of laser skin resurfacing. The conditions you should avoid treating with microdermabrasion are keloid scarring, raised moles, raised warts, skin tags, shingles, eczema, herpes simplex 1, rosacea, psoriasis, chronic eczema, seborrheic dermatitis, actinic keratosis, skin cancer, telangiectasia, and open sores and cuts. The non-visible contraindications to microdermabrasion are active diabetes, because diabetics do not heal normally, oral blood thinners, hepatitis, autoimmune diseases such as vitiligo and lupus, the use of Accutane unless it has been discontinued for at least 6 months prior to the treatment, and Retin-A unless it has been discontinued for at least 7 days prior to microdermabrasion.
When you are using microdermabrasion within your clinical environment, you need to be very aware of certain conditions to avoid. Number one would be keloid scarring. Keloid scarring is a scar that continues to grow, and it has been aggravated by many other factors. If you go over this very active scar, you could possibly be making this scar worse. So it's very important that you avoid this specific condition on the skin. Raised moles are another condition that really needs to be carefully avoided. Because we are not medical personnel, we are not able to really define what this mole actually is. And there are many different types of moles that are associated with the body. As aestheticians, it is important for you to avoid this specific disorder because you are not aware of exactly what this type of mole is. And you certainly don't want to be exacerbating a potential problem that might be underlying in the skin's condition at this time. In spite of the fact that microdermabrasion has become a legitimate source of skin resurfacing, we now are going to be entering into a new phase called microdual peeling. What is microdual peeling? Microdual peeling is taking selected bioactives and applying them directly after microdermabrasion. Microdual peeling is still controversial as we speak. However, many medical institutions and aesthetic facilities are currently utilizing this type of peeling modality with their patients. It is important that you have established a very firm background with this patient and understanding how they've responded to various peeling agents as well as microdermabrasion before you begin to proceed with this particular type of treatment. Before you begin any type of peeling program, it's very important that you begin to prepare your client's skin. And that is never so true as with microdermabrasion. Placing your clients on the appropriate products is very important for the first 30 days before you begin the program. And then, as a follow-up, to begin them also on post-microdermabrasion. Using simple kits is easy for your client to be able to provide a more effective and thorough skincare regime where they can initiate this at home without having supervision. As a skincare health technician, I believe it's very important that before you begin any treatment, whether you're using home care for your client and advising them to follow through, or you are going to initiate peels such as salicylic, Gesner, or AHAs, or even beginning microdermabrasion, it's imperative that you know your client's skin thoroughly. Photodermatology skin analysis health form is the nucleus to studying your client's skin and compiling a full history on that patient. It's important that you note their lifestyle with sun exposure, that how many hours they spend out in the sun a day, their lifetime sun damage, whether or not they are wearing sunscreen, the amount of sunscreen, whether it's full spectrum or not, and if they are a smoker, and what is their sunburn healing response. Does this patient have any health complication? And when did their mother start menopause and at what age? This is important to note because there are significant changes that occur in the skin when a woman becomes perimenopausal. There are other elements that you must fully investigate, and that is their ethnic background, their Fitzpatrick skin type from 1 to 6, their Glogau classification from 1 to 4, and what their subdermis thickness is. And in addition, it's important to note that what their skincare program is currently and whether or not they are using this product daily, once a day, twice a day, or 3 times a day. And where do their products come from? A drugstore, a department, a professional, or are they prescription? This will help you to determine what your client has been using and should be using, and what is the initial root of this client's problem and where it is located in the skin itself. Your Woods lamp will determine the depth of damage to pigmentary disorders, whether or not they are located more in the epidermis or in the dermis at this time. And then you will take note and put this on this particular analysis form to ensure that when you begin microdermabrasion, that this will implement the appropriate treatments that you can begin with the client. To augment your photodermatology analysis form is the cosmeceutical interaction skincare form. This is important because it also helps to note if there's been any contraindications or irritations brought upon by other types of skincare or peels or what they are taking systemically, such as medications or herbal remedies that you need to take note of. For instance, hypercum or St. John's wort can actually make the skin more sun sensitive. So you need to, as the medical skin technician, to take note of everything your client does, and this interaction form will help you to understand what is going on systemically with your patient. Your next form is your MDA, or your microdermabrasion analysis form. This form is very important because it helps you to keep a history of all of the microdermabrasion treatments that you're currently performing with your client, along with any other type of modalities such as peels. Part of your analysis is always going to be assessing the appropriate Fitzpatrick type. This is important because it's going to give you insight to how this patient reacts to ultraviolet radiation. There are 6 different types from 1 to 6. This also gives you the important information with regards to how much protection is in their skin with regards to melanocyte protection. Type 1 skin always burns and never tans, where your type 2 skin usually burns and tans with difficulty. Type 3 is a white skin that sometimes burns and has a tan every now and then. Type 4 is a brown type skin, rarely burns, and will tan with ease in many cases. Type 5 skin is dark brown, very rarely burns, and tans extremely easily. Type 6 skin is black, never burns, tans easily. And last but not least, and probably one of the most important forms next to your photodermatology analysis form, is the signed consent form. You, as a responsible skincare technician, should very carefully go over everything about your microdermabrasion analysis treatments. It's important that your client understand everything about microdermabrasion and what they need to be doing before they have this treatment and what they need to be doing after the treatment, as well as giving you permission to do the treatment. So be sure that you have your client sign one of these forms and that they read it thoroughly. I also endorse the practice of having a copy of this form that your client has so that it will cover all bases for you. That is the responsibility of a good technician in skincare. Adding microdermabrasion to your menu of salon services is a very sound business decision. It will help to protect your core business. It will give you a competitive edge, whether you're an esthetician or a physician. It keeps your clients loyal because they know you are on the cutting edge of new modalities of treatment to fight the war of aging. It will increase your prestige among other customers, and you have a higher per hour service income at a very low cost to you. Microdermabrasion is also a perfect complement or alternative to alpha hydroxy acid peeling. New retail opportunities will begin to open when you introduce microdermabrasion into your salon. Special skincare products will be now introduced and allow you a much better bottom line for your active retail clients. This is your way to introduce home care to your clients in addition to other products that you can make available for now and in the future. Marketing microdermabrasion is very important because it lets your clients know that you now have a new treatment available. Have a poster up in all of your treatment rooms so it keeps them right abreast of what you are doing. Have a sign on the front desk. This will give them an announcement that you now have a new service available. Keeping brochures is something they can take home and have for future reference. And of course, don't forget having direct mail. This is your most beneficial source of letting your clients know that you have this service and that you're ready to treat them at any time. Also, to let your clients know that you are offering these microdermabrasion treatments is to incorporate it into your Yellow Page ad and on your website that you currently have. In order to not compromise your integrity as a practicing esthetician, don't promise things with microdermabrasion that you can't deliver or are not substantiated through sound medical documentation. It's important that you only give your clients what you are able to provide them and do what is legitimate with this particular machine. Microdermabrasion is a very effective way of treating acne scars, of treating lines and wrinkles, and hyperpigmentation. However, we want to be ensured that we always operate within our boundaries to provide sound, good, healthy skin care.
Microdermabrasion is performed in a series of treatments. Generally, the patient will realize noticeable results within 3 to 6 treatments. Treatments should be spaced 7 to 10 days apart. The pricing structure for microdermabrasion varies with market demand and geographic location. Typically, however, treatments can range anywhere from $100 to $175 per treatment, with discounts taken for series of 3, 6, or 12 treatments.
Most manufacturers do offer in-clinic service where they will teach you for 2 to 4 hours on how to operate their microdermabrasion machine.
We have just completed Margot's face, and now she would like to have her décolleté done. So we'd like to just take this opportunity to explain and show you how to do the décolleté. Hers is basically quite normal, natural. She'd just like to maintain that. So what we're going to do is we're going to keep it on fairly low. We're going to vacuum the décolleté first, create a little redness and a little warmth to the area to prep it for the crystals. So we're going to push down on the skin, and why don't you look up just a little bit more. We're creating a little redness here. It allows me to read the skin, create a little erythema so that we have a little bit more skin mass when we throw the crystals. This is basically done to the client's request as far as how low you want to take this down to the décolleté. You can go as low as they want. Just make it as even as possible. You want the right side to be like the left side. How does this feel, Margot?
Oh, it's fine. It's relaxing, actually.
We kind of like to take the fear out of microdermabrasion by vacuuming first because it is a way to energize the tissue and cause a lot of relaxation for the client. So it does tend to take the fear factor away, and I think the discomfort is down to a minimum. Always keeping a nice stretch on the skin. If you can use your whole hand, it's much more comforting to the client to hold her. Use your whole hand if possible. I'm applying no pressure whatsoever. The machine is doing all of the work. I am just gliding the maniple 90 degrees to the skin. Following with your left hand, not far from the right. Now we're going to push phase 2, which is the crystal mode, and we'll start where we were before. Leaving a trail of crystals so that we can see where we've been. Working fairly quickly for less discomfort. This typically is quite a sensitive area, and it does create a little bit of a bite here. The slower you move the maniple, the more exfoliation. So we're going to do a little bit on the quicker side. If we want to go back over it again, we can do the same thing over twice. Same effect, less discomfort. Keep the skin taut. Again, I am not applying any pressure. The machine is doing all of the work. The pressure is set to near low. Doing a few circles around the most sun-exposed area. Skin cells are dimensional, and they have a way of loosening up if you can go around them in a complete circle. Stop the flow of crystals. Quickly vacuum up your mess, leaving for a cleaner treatment room, and not so much discomfort in trying to brush those crystals off. This is done quickly and usually in a manner that takes up the crystals. If you have to go in a downward manner, sideways, whatever flows with the skin at this point to remove the crystals is fine. We take cold sponges. I like to use a chamois type sponge. It takes away a lot of the crystals much easier, any leftover crystals. This is very cold water. Keep it in the area. Feels good. Turn the sponges over. You can push on the skin at this time. You want to push those crystals off. I like to take a 4x4 and put a little calming lotion on it, witch hazel based. Cools it down. Then we like to hydrate it. This is a liposome cell renewal lotion. Hydration is important at this time. And we'll follow this up with a liposome moisturizing sunscreen, SPF 30. This is Anne, and she's come in today. She has a Fitzpatrick type 2. She's also had a little bit of sun recently, and she also has some sun damage. She's just in here for a basic treatment, and so we're going to start. First, I'm going to change the tip. Put on a fresh tip. These are disposable tips. Since this is the first time Anne has been here, we will probably start our setting on low, just to get an idea of how her skin reacts to the treatment. We're going to start on the chin, and we're going to work our way up, and we're going to start with half the face first. We vacuum the skin first. Bringing blood flow to the skin, energizing the tissue. It's a way of basically prepping the skin. It also comforts the client, takes a little of the fear factor away, and it's quite relaxing. It allows me to read the skin, think ahead on how I'm going to do the crystals, come up around the side of the face. You can go back down, coming back up. Feels very good to the client, especially around the sinus area. Noses are usually treated per patient. If you have to push the nose forward, you push it forward. If you have to push it down, you push it down. But the nose is very important. So you make sure you get as much as you can and be as thorough as you can. I'm pushing the skin down as I'm going back. Keep in mind, I'm still doing just half of the face. I'm going right into the eyebrow and one swipe under the eyebrow. Then going back. Try and stay behind the client as often as possible. Keep your movements free. Flow with her contour. Come back and divide the face in half. And repeat exactly what you did on the left side of the face that you did on the right side. Now she's got a nice redness all over. We'll start to throw crystals, and we start again on the same half of her face. It leaves a trail of crystals so we know where we've been. I am also, again, not pushing on the skin. The machine is doing all the work. It's at the correct pressure for her first time treatment. We're doing some circles which do really well with hyperpigmentation. We come over to the ear. The ear, believe it or not, is not very sensitive, so you can spend a little time here, and it feels great, if not a little odd. We center her. The lips can be quite sensitive, so we want to try and get to these and quickly move it. If an area is very sensitive, you can leave it and then go back to it, and leave it and then go back to it. Try and do the job you need to do with as least discomfort as possible. So if you have to leave the area, return later. Because as soon as you stop, the pain goes away, or the discomfort goes away. Again, we're following the muscles of her face. As we get closer to the eye, we're going to have shorter strokes. Because it's a sensitive area, we can go back the other way and back the other way again. Side of her face, coming up towards her forehead. Center her again. I'm a nose person. I like to really do the nose. Go straight back, go right off into the hairline. Go into the eyebrow, and one underneath. Then all the way back. I find if you hold them with your left hand quite firmly, it tends to take away the bite from the crystals. So don't be afraid to hold them. Do some circles here. Just get a little pigmentation. Again, when I do the circles, I'm not pushing, I'm just going in a circular motion. We divide the face in half and do the exact same thing on the left side that we did on the right. We'll analyze both sides of her face to make sure they look even. Touch a few spots. The circles actually help eliminate any kind of striping that may occur. I like to keep the crystals on the face so that I can see where I've been. I don't like to wipe off the crystals. We're vacuuming up our excess crystals. If we have to go in a downward manner to get them off the face, that's fine. We don't follow a set pattern. Just quickly vacuuming them off the face. I use cold, damp sponges to remove any excess crystals that were left on the face. Cool the skin down a bit. Turn the sponges over. Don't forget the ears, earlobes. You can rub the skin a little bit at this time. It actually feels nice. We'll use a calming lotion. Basically, what this does is normalize the pH and cool the skin. I only use 4x4 gauzes. It leaves little or no lint on the face whatsoever. It's all I use now in my treatment room. I'm going to use an oxygen delivery system of vitamin A, C, D, E, and K, and CoQ10. We're feeding the face. Since this is mostly vitamins, we're going to then hydrate it with a cell renewal. It's a liposome base with vitamin A and E. And after this, we'll put on a sunscreen, SPF 30. Everything at this point that you feed the face, basically your skin drinks it up. So I like to layer my products. You should stay out of the sun at least for this following week, and every day use sunscreen. SPF 30 would be most beneficial. You need to hydrate. If your face gets warmer later on today, do not use ice, but cold compresses are fine. Stay out of hot showers, saunas, anything extra hot or anything extra cold you want to avoid. But cool compresses will be fine if you get any warmer. Hydration is important. We'll set you up with a post-microdermabrasion kit so that you can use it at home for follow-up treatments. And we'll see you in 7 to 10 days. This is Kathy, and she's come in for an arm and hand microdermabrasion. She has typically sun damage through years of sun exposure, plus I think she has a little bit of natural freckling. So we can help a lot with the hyperpigmentation and maybe lighten up the freckles a little bit. So what we're going to start to do is we're going to do her arm, and then we'll follow on down to her hand. We can set the machine up a little on the higher side because her arm is usually a little bit more tough. We're going to vacuum first. Raise it up a little bit. Now I'm holding her skin taut between my hands. Basically my whole hand is on her arm and pulling her skin taut. You can use fairly long strokes in the vacuum mode. I'm pulling blood to the surface, energizing the tissue, helping the body to heal itself. You can go upward and downward with the vacuum mode here. Work around the bone. If you have to pull the skin over, you work on the skin, and when it comes back, it goes over the bone. You can also go around it. I'm not pushing on the skin. I'm just letting the maniple glide along the skin. Now hold her hand this way, and we turn it to create its own natural stretch, and we vacuum the hand. You can go down on the fingers if you would like. She does not have sun damage on her fingers, so right now we're just going to do the hand itself. All right, we're going to throw crystals. We're going to start back at the top where we were before. I've got her skin held very taut, and I'm going in circles. It's a little more intense this way, but it really is a nice way of lifting off those skin cells. You can just walk your handpiece all the way down the arm. I would say Kathy would see very good results in about 4 to 5 treatments. Same here, we take hold of the hand and bend it so we have a natural stretch. The hands are fairly tough because of what we put them through on a day-to-day basis, so we can spend some time on these hands. The entire time I keep the handpiece on the hand, we're throwing crystals. As soon as I release the handpiece from the skin, it stops the flow of crystals. This is also known as a closed loop system. Take a look at your work. Make sure it's even. Touch up any spots that you think that you might have missed. Stop the crystal phase and vacuum off. Long, fast strokes. You don't have to spend a lot of time with this, just trying to clean up your mess. Use a cool sponge. Wipe off any excess crystals. Follow the same with the calming lotion. Basically what I think I'll do next is put on a bleaching agent because of her hyperpigmentation. Kojic acid along with hydroquinone. Apply it directly after the treatment. Rub it on. This helps in the bleaching action throughout the week until she comes in for her next treatment. She may apply this every day. And we'll use a sunscreen, SPF 30, which she will need every day. Arms are typically exposed to most of the sun from driving, and this is a common problem. I'm doing a treatment on this young lady's heel, and it's something that can be used in your pedicure room to alleviate calluses or to help bring the skin back to normal again. So we're doing the same approach. We're vacuuming up, trying to loosen some of this dead skin. We've already prepped her. And then we're going to throw crystals. I've got the machine set on high. We're just working right where it's calloused and just the surrounding area. Now we're going to throw crystals. Then I'm going to hit the foot pedal to stop the flow of crystals so I can clean up the area. Wipe off the excess crystals. Then we like to hydrate it. This is a liposome cell renewal lotion. Hydration is important. We'll set you up with a post-microdermabrasion kit so that you can use it at home for follow-up treatments. And we'll see you in 7 to 10 days.
While the actual machines used for microdermabrasion have been likened to sandblasters and vacuum cleaners, they're really rather sophisticated. Selecting a microdermabrasion machine is a big investment, and you need to do some research. Here are some things you need to consider. How much does the machine cost? Is it easy to move from room to room? Is the machine noise level tolerable? Is it easy to refill and empty the crystal containers? Are the crystal containers disposable, or do you need to clean them? How much do replacement filters cost? Does the manufacturer provide product education? Does the manufacturer provide technical support? Is there a warranty that comes with the machine? Which handpiece design is best suited for your treatments? How much do replacement handpieces and tips cost? Are the tips disposable? Is the machine clog resistant? Here are 2 typical models of microdermabrasion machines.
This is a Microdermax 1200. We manufacture this machine in Bologna, Italy. This is what we call a dual function machine, whereas it has an aspiration and or vacuum mode only, and then the crystal mode. You can then vacuum up your crystals at the end of the treatment, so you can have a sole vacuum mode and a sole crystal mode. It is a digital panel. You have your pressure control for the phase 1 and your handpiece, which is a titanium handpiece, and a disposable tip. It's disposable or sanitizable tip. This is a titanium piece. It has a 1 millimeter opening, and it aspirates through these openings around the outside of the center of the maniple. This maniple can be taken from the lines itself, pulled off, and sterilized separately. It has a treatment time meter. It tells you how long your treatments have been, so you can document treatment time. On the back, it has total machine time by the minutes. It gives you how long the machine has been running, as far as how many minutes the machine has been in operation, for those of you that want to have more than one esthetician or technician using the machine. It has a foot pedal that you can depress, and the entire time you depress it, it stops the flow of crystals. So when you release it, it begins the flow of crystals. And this is good for body treatments when you want to stop and clean up the area so you can see it with hypertrophic scarring. It's great for lips, so as soon as you get those crystals on the lips, you want to vacuum those off immediately so they don't lick their lips and get crystals in their mouth. There's 2 containers in the back. This is the supply container, which has the microcrystals in it, and this is the waste container where the used crystals go that are then put in a biohazardous waste container. To clean, this is a filter. There's a porcelain filter in here that can clean the container so that you can keep it clean at all times. And you would just compress the maniple and push this down, and the pressure of the air just cleans the filter. This machine is worked and used with vacuum. When you lose vacuum, you lose your machine. The tip also has an O-ring. It also needs to have a nice tight fit. Tight enough, not too tight that you can't take it off to replace it, but a nice close fit to the O-ring. This keeps all the connections nice and tight so you lose no vacuum. Never cover the machine with any sort of plastic. Make sure that if you use anything, any kind of cover, you use a sheet. You don't want to create any humidity. If there's any clogging at all in this machine, it will happen in the blue line. We call this the blue line because there's 2 blue fittings, and you can see it because this line will then be white. All of these other lines basically will have no problem. So these are all clear, and you want to make sure there's no kinks in these lines. When you empty the waste container and you put it back, you want to make sure there's no kinks in any of the lines. So if you have any kind of problem, it's where there is no crystal flow.
Okay, this machine is the Dermablast, and I manufacture and make this machine in Grass Valley, soon to be Reno. Features of my machine over other machines are, this has a 2.5 pound sand capacity. I guess I'll just take my gloves off. And you pour the sand directly into this tank. The sand comes through this tube, and the used crystals are collected on this side of the machine and you simply lift up the bag, put a seal over the hole, and drop it in the trash. That way the operator never comes in contact with any contaminated crystals. And this machine also is bigger, larger than the other machines on the market, because from here on down I have 3/4 of a horsepower. My compressor is a continuous duty compressor, which is a guarantee to the person who buys this machine. It will never go down. You can do 50 treatments a day, 5 treatments a day. It will consistently work. When I first discovered microdermabrasion, one of the problems with the existing equipment was they kept thermostatically overheating, and eventually it would bring down the compressors. And the doctor's office where I was taking a course had 4 machines, and 2 of them were back in Italy being repaired with new compressors being put in. So I tried to address every problem that I saw on the existing microdermabrasion machines. Also, this handpiece, this is unique to microdermabrating because, as you saw when I was demonstrating, I do not leave any striping, and I can cover a large area in less time because I can do a grid and I have a larger surface area. You can do twice the face in half the time. Plus you can do more clientele. So once you have a continuous duty compressor, 3/4 of a horsepower added with the handpiece, you can do twice as many clients. It's mobile, wheels between treatment rooms, so you don't have to disturb your client. And if you're giving him a treatment in room A, you can easily move your machine into room B without disturbing anybody. Also, my machine features an anti-clogging system. Has crystal heaters. If moisture should be in the room and gather in your crystal tank, the heater keeps the crystals dry to keep it from clogging. And if by any chance you should get a particle in the crystals, you simply lift out the pickup orifice, and your clog will be right here at the tip. Blow it off and put it back in. You don't have to back out your lines or anything like that. It's very simple. And this keeps the machine virtually clog-free. And the pickup tube also has a feature of exchangeable tips. Now the tips, you can pick up more sand, less sand, depending on what you're working on. If you're working on somebody's back that's, say, hairy, you would want more sand. So you would go for the orange tip that allows more sand to come through. And if you are working on older, thin skin, you would want a minimal amount of sand with more suction, and you would use the green tip. Normally, you will always stick with the gray tip, and that's pretty standard. Works well with most skins, acne, or whatever you're working on. But there are 3 interchangeable tips, so you can customize your sand flow. And these tips basically will never wear out.
As we've seen, microdermabrasion is indeed a remarkable addition in the pursuit of more youthful, healthy skin. We hope this program has been helpful by providing an in-depth explanation as to what microdermabrasion is, how it works, and how a wide range of clientele can take advantage of its many proven benefits. For more information about this program or to find out about other programs offered through Aesthetic Video Source, please call us from North America at 1-800-414-2434. Outside North America at 801-282-2490. Our address is Post Office Box 673, West Jordan, Utah 84084. Additional information can also be found on our website at www.videoshelf.com. For more information about this program or to find out about other programs offered through Aesthetic Video Source, please call us from North America at 1-800-414-2434, outside North America at 801-282-2490. Our address is Post Office Box 673, West Jordan, Utah 84084. Additional information can also be found on our website at www.videoshelf.com.